So croup, they'll have a seal bark cough. That's the big thing with croup. They have a seal bark cough, and that's because the larynx is swollen. And we usually see this in younger kids up to like 3 years old. Epiglottitis. This is when the epiglottis is irritated. We use the epiglottis for swallowing. We have to move the epiglottis to allow fluids to go down the esophagus and not into the trachea. So that's why when the epiglottis is irritated, it hurts to swallow. So that's why you'll see drooling as a common symptom of epiglottitis. RSV, or respiratory since I can never say this right. I call it RSV. That's what everybody calls it. Bronchiolitis and RSV come together. RSV is a virus. It basically causes inflammation in the lungs and infection. And then the bronchioles get inflamed and irritated and fill with fluid. So usually if a toddler or newborn has RSV, they'll have bronchiolitis following it. Pneumonia is basically an infection of the lungs. And we really see this mostly in people who are either chronically ill, really young, or really old. Pertussis is whooping cough. So as long as you know pertussis is whooping cough, you should know the sign of that. It's when they make a whoop sound after a cough attack. So they're coughing and then you hear this whoop sound, and that's pertussis or whooping cough. The flu is just like pneumonia. It really affects the very young, the very old, and the chronically ill. It can be a pandemic. In 2009, there was a flu pandemic. Tuberculosis or TB. This is something that it's recurrent. They continue coughing. They have those coughing fits that don't go away. They may get better for a couple of days and then they get worse again. Things like that. Fatigue. Night sweats. This is the only condition that we study in this class that I know of that causes night sweats. So if you see night sweats, it's probably tuberculosis. Again, protect yourself from these patients by putting a mask on them and a mask on yourself. Hopefully you have an N95 that's been fit to you. Pulmonary edema. Remember, this is fluid in the tissue of the lungs. So that fluid can sometimes leak into the alveoli and then come up into the mouth. So you may see this pink frothy sputum that's continuously coming up into the mouth. That's a big sign of pulmonary edema. That fluid is leaking out of those cells and into the alveoli and by proxy up into the mouth. Pulmonary embolism, remember this is caused by a blood clot in the circulation of the lungs. That causes sharp chest pain. And it can also cause hemoptysis. You should know what hemoptysis is by now. It's coughing up blood. Make sure you know that word. But hemoptysis and sharp pain, coughing up blood, those are big signs of pulmonary embolism. Airway obstruction, they could just have something obstructing the airway. Vomit, blood, swelling, the tongue falling back in the airway, food, a toy. That could be a cause. So, consider that they could be choking. Hyperventilation is when people breathe extremely fast or extremely deep, sometimes both, and they basically get the oxygen levels really high and the carbon dioxide levels really low in their blood. It's going to cause a higher base in the blood or body tissues. Sometimes people have like a panic attack and they hyperventilate for no reason. Well, for a reason, but not for a chemical caused reason. That might not be the right way to say it either. They're not doing it because their blood balance is off. They're doing it for some other reason. But other times, someone may be hyperventilating to breathe off some excess acid that's built up in their blood or bodily fluids. So, for example, somebody who has diabetes, and their blood sugar level gets really high, they'll be breathing off that excess sugar that's in their blood. Another example would be somebody if you've heard of rhabdomyolysis, where somebody works out really hard and they tear up so much muscle tissue that they have damaged cells floating around their body they need to get rid of. And so all that lactic acid that their cells release needs to be breathed off. They'll hyperventilate. So those are some other examples that could cause hyperventilation. But the hyperventilation causes a buildup of excess base in the bodily fluids. And so notice a panic attack can cause hyperventilation, but also hyperventilation due to rhabdomyolysis or high blood sugar can cause hyperventilation, which then causes the symptoms of a panic attack. So there's no way to know for sure in the field if somebody's having a panic attack or hyperventilating. they, or hyperventilating for because they have built up acid in their blood for some reason. So it's really hard to treat for that reason. So it can cause anxiety, dizziness, numbness, tingling, or painful spasms because of that buildup of oxygen and lack of carbon dioxide in the blood. So how do we treat all these conditions? Well, give people oxygen, monitor their breathing. If they're having an asthma attack, they may have an inhaler. They may have a nebulizer if they have other chronic conditions or COPD, things like that. If you're giving a medication, always call medical control first. And most of these medications are just going to relax the bronchioles to make it easier for them to breathe. If somebody's has an airway infection like epiglottitis or bronchiolitis or one of those, try to use humidified oxygen if you can. And you really don't want to suction the airway if they have epiglottitis or croup or something, because you can irritate that area at the back of the mouth and cause more swelling and make the problem worse. So when somebody's having trouble breathing, always try to sit them in a comfortable position. Usually they're going to want to sit upright, and get them to the hospital quickly so they can get help. Pulmonary edema, again, acute pulmonary edema is sudden onset. They just get a bunch of fluid buildup in their lungs. Give them high flow oxygen. If they have that pink frothy sputum that's common coming up into their mouth, suction that pink frothy sputum. Position them however it's comfortable for them to breathe. And this is one of the biggest uses for CPAP. Remember, CPAP, continuous positive airway pressure, it forces that air down their throat and pushes that fluid from the inside of the alveoli back out into the interstitial space where it's supposed to be, and get them to the hospital. COPD, they may have an inhaler, help with that. If they've already overused their inhaler too many times, they basically are going to have a bunch of adrenaline. So they'll be kind of jittery, fast heart rate, things like that. Don't give their inhaler if they have signs of overusing it already. Keep them comfortable, get them to the hospital. Asthma, hay fever, anaphylaxis. Asthma is kind of lumped in with an allergic reaction because it has a trigger, just like an allergic reaction does. It's the body's response to something. So if they have asthma, they may have an inhaler. If they have anaphylaxis, they may have an EpiPen that you can help them with. But call medical control before you give a medication, and just help them breathe and get them to the hospital. Pneumothorax is a collapsed lung. Give them oxygen. Get them to the hospital. There's really not much you can do for them. Call for a paramedic if it's starting to look like a tension pneumothorax. Pleural effusion is fluid outside the lungs. That fluid has to be removed in the hospital. So give them oxygen, help them breathe, get them to the hospital. Airway obstruction, remember, if they can still make noise, give them oxygen, get them to the hospital. If it's a severe, complete airway obstruction and they can't make any noise, if they're over age 1, do abdominal thrusts. If they're under age 1, we'll do 5 back slaps followed by 5 chest thrusts, and get them to the hospital. Give anybody who's having trouble breathing gets oxygen. Pulmonary embolism, remember, that's a blood clot in the veins and arteries that go through the lungs. So there's nothing we can do to treat that in the field. Keep them comfortable. If they're coughing up blood, we call that hemoptysis. You may need to suction the airway. Just get them to the hospital. There's really not anything you can do for them in the field. Even a paramedic can't really do anything for them other than give them oxygen. Hyperventilation, if somebody's breathing really deep and fast, try to get a history to figure out, could this be diabetes? Could this be rhabdomyolysis? Could this be some kind of extra acid buildup in their blood from some infection or something? Do not have them breathe into a paper bag. I'll be honest with you. If it's truly a panic attack, breathing into a paper bag will fix it, just like it does on TV. But remember what I said earlier, there's no way to know in the field for sure if it's a panic attack or some other cause. If they're breathing deep because they're trying to breathe off extra sugar or lactic acid or something like that, and you make them breathe into a paper bag, you will kill that person and you'll be held liable. That would be negligence on your part, without a doubt. So never have them breathe into a paper bag. Just reassure them, try to calm them down. Here's some oxygen, give them oxygen. Here, breathe with me. We're going to breathe in and we're going to breathe out, and try to talk them down and calm them down. Sometimes people can be exposed to chemicals like cleaning items or carbon monoxide poisoning or something like that. Make sure the patient's decontaminated and treat their symptoms. Give them oxygen to dilute whatever they inhaled. If they're unresponsive, you may need to use airway adjuncts. If they're, vomiting or have frothy sputum coming up, you may need to suction their airway. Do what you have to. We already talked about foreign body aspiration. If they have something that's blocking their airway, clear it. Give them oxygen. Tracheostomy dysfunction. Sometimes the tube or the hole in the throat can get mucus buildup. You may need to suction the tracheostomy. Just like any other patient, you would suction for an adult no more than 15 seconds, a child no more than 10, an infant no more than 5, and no further than you can see. Provide oxygen over the tracheostomy, not over the mouth and nose. They don't breathe through their mouth and nose, so provide oxygen over the neck. Asthma, use that inhaler if they have it. Otherwise, give them blow-by oxygen. They probably aren't going to be able to tolerate a non-rebreather over their face. If you're having trouble breathing, it's really claustrophobic to put something on your face, but they can hold that oxygen in front of their face. Cystic fibrosis is just a genetic disorder where the lungs and digestive system break down. Suction if they need it. Give them oxygen if they're having trouble breathing.